Hello and good morning, everybody. Welcome to this webinar on the Supporting Psychological Health in First Responders Grant Program. This event is brought to you by the Ministry of Jobs, Economy and Trade with the Government of Alberta. My name is Catherine Lanier, and we truly appreciate you taking the time to be here with us today. We hope you find today's session valuable, and we encourage you to participate by engaging with the polls and sharing your questions. Today, I am happy to be joined by an excellent team of presenters. The bulk of the presentation will be led by Ella Ritz, our Occupational Disease Research Associate with our Ministry of Jobs, Economy and Trade, who plays a key role in supporting the SPHIFR program, in addition to her other work mobilizing evidence to guide occupational health and safety policy and program delivery. Our other government colleague today is Dr. Karina Thomas, the Occupational Disease Scientific Lead and the head of the SPHIFR grant program, who will help to answer questions at the end of the presentation. We are also joined by some successful SPHIFR grant applicants who are going to share their experiences today. We have Craig Hernchuk, Dr. Suzette Vermel-Phillips, and Dr. Chelsea Jones. Craig is the Executive Director of the Alberta Municipal Health and Safety Association, commonly referred to as AMSA, and is a senior executive with a passion for operations and over 25 years of progressive experience in organizational transformation, board governance, and corporate service roles in the industry sectors of infrastructure, construction, utilities, telecommunications, manufacturing, aerospace, healthcare, municipal, and not-for-profit associations. Dr. Suzette Vermel-Phillips is a professor in the Department of Occupational Therapy and the director of HIMARC, which is the Heroes in Mind Advocacy and Research Consortium at the University of Alberta, and a recent recipient of the King's Coronation Medal. Finally, we have Dr. Chelsea Jones, who is an occupational therapist working with military personnel, veterans, and police, and is also a postdoctoral fellow at the University of Alberta. Her research focuses on cognitive assessment and treatment, mental health assessments and treatment, moral injury, trauma, and workplace reintegration within military, veteran, and public safety personnel. So I thank you for joining us today, and I hope everybody gives you a warm welcome. We acknowledge that what we call Alberta is the traditional ancestral territory of many peoples presently subject to Treaties 6, 7, and 8, namely the Blackfoot Confederacy, the Kainai, Piikani, and Siksika, the Cree, Dene, Saulteaux, Nakota Sioux, Stoney Nakoda, and the Tsuut'ina Nation, and the Métis people of Alberta. This includes the Métis settlements and the 6 regions of the Métis Nation of Alberta within the historical Northwest Métis homeland. We acknowledge the many First Nations, Métis, and Inuit who have lived in and cared for these lands for generations. We are grateful for the traditional knowledge keepers and elders who are still with us today, and those who have gone before us. We make this acknowledgement as an act of reconciliation and gratitude to those whose territory we reside on, play on, or are visiting. And now, with that, I will pass it back over to Ella, and I hope everybody enjoys the presentation.
Thanks, Catherine, for that introduction. Here is a quick overview of where we, okay. So here's a quick overview of where we will go today. I'll start off with an introduction to SPHIFR, and we'll cover why this program started and how it has evolved over the past 5 years. I'll carry on to provide an overview of funded projects, breaking them down by types of projects funded, and giving you an idea of the subject matter. We'll then go on to discuss the application and review process, after which we will hear from 2 of SPHIFR's successful applicants. And finally, we'll end off with some questions. Our goal today is for you to become better acquainted and comfortable with the SPHIFR program, how to apply, and our rigorous review process. We also hope that this will spark some ideas for you on potential services or research projects to submit for funding. As mentioned at the start of the presentation, SPHIFR stands for Supporting Psychological Health in First Responders. SPHIFR was established by the Government of Alberta in 2020 in response to the growing recognition of the mental health challenges faced by first responders. These workers frequently encounter stressful, dangerous, and traumatic situations as part of their jobs, and this leads to significantly higher rates of post-traumatic stress injuries, or PTSI, compared to the general population. In following years, the program was expanded beyond first responders to include other emergency workers who encounter similarly stressful and dangerous situations and are at risk of PTSI. Ultimately, the purpose of the SPHIFR grant program is to address these high rates of PTSI among Alberta's first responders and emergency workers by providing dedicated funding streams aimed at both delivering direct services and supporting research. focus of funded projects and services should be on effective prevention and intervention strategies, including the evaluation of existing and new programs. Ultimately, the SPHIFR program aims to improve mental health supports for those who face stressful and traumatic situations in their line of work, ensuring they receive the care and interventions needed in order to prevent or lessen the severity of PTSI from occurring. Before I carry any further, let's go over some definitions to make sure we're all on the same page here. So first responders include firefighters, police officers, paramedics, sheriffs, and corrections officers. As I mentioned previously, consideration of emergency workers was recently added to the SPHIFR program. Emergency workers are those who encounter serious, unexpected, and often dangerous situations requiring immediate action as part of their jobs. And just some examples are social workers, support staff in organizations who might be dealing with potentially dangerous clients, nurses. And then finally, PTSI, post-traumatic stress injury, is a broad and non-clinical term, which includes a range of mental health injuries, including operational stress injuries, anxiety, depression, and also post-traumatic stress disorder. And before we carry on any further, I thought it would be fun to get a sense of who is in the audience today. So here the question is, are you or do you represent police workers, firefighters, social workers, nurses, paramedics, correctional workers, public safety workers, other first responders, other emergency workers, academia, or none of the above? And if it's none of the above, feel free to enter it in the chat if you're comfortable or want to share. I'll give you a second to respond. Catherine, when the poll is done, will I see the responses?
Yes, and so it's still being filled out, but it looks like no worries. It's in the chat right now. So it looks like we've got about 18% are in academia and researchers, a lot of firefighters on the call, and then we've got about a quarter who are none of the above. So we've got some clinic directors, education, community practitioners, and representatives of mental health clinics that support first responders. Very nice broad representation.
Great, thanks everyone for sharing, and Catherine for providing that summary. Okay, so SPHIFR has two streams. For stream one, the services stream, we fund projects that provide services that support first responders or emergency workers living with or who are at risk of PTSI in Alberta. The organization requesting funding must be a not-for-profit or public sector organization. For stream two, the applied research stream, we fund qualified researchers to conduct research that develops and evaluates effective programs and services to support Alberta first responders or emergency workers. For both, projects must be 12 months in duration. And here's another poll question. So I'm curious to know if you have participated in this SPHIFR program or have you applied for funding in the past?
And with about 36 respondents so far, we've got about most say no. So 70% are no, 20% are yes, and 10% are not sure.
Okay, great. Well, I hope that you, all of you who have not applied in the past will learn lots in this presentation today. Okay, so here I provide a summary of the funded projects by cycle. We've been running SPHIFR for 5 years, starting in 2020, and each year we have awarded approximately $1.5 million towards these services and research projects. The average success rate across the 5 years is 32%, 33%, although a greater proportion could be funded. So if, for example, if you look at cycle 4, over half of the applications were successful. The overall success rate and the breakdown of the number of services and applied research projects funded depend on the quality of the applications that we have received and the funding amount requested. We are currently in cycle 5. Just as an FYI. So successful applicants were notified in early January, and projects are just in the process of being started now. And this is something I want to emphasize. The SPHIFR projects and studies don't necessarily need to provide services to first responders and emergency workers. Rather, our goal is to ultimately support these workers. And so while we definitely do want to include workers in some of our projects, we are also interested in other potential participants, such as frontline supervisors and family members, since these folks play pivotal roles in supporting workers and their recoveries from PTSI. This is a graph that describes the funded projects by the worker group considered. The dark blue bars represent the number of funded research projects, while the light blue bars represent the number of services projects that have been funded for each category. Overall, we see that the majority of projects focus on first responders collectively, followed by emergency medical services. Something that I found interesting is that funded services have mostly targeted first responders, emergency medical services, and firefighters, whereas the applied research projects are looking at a much broader range of workers, including public safety personnel, police officers, wildfire and other natural disaster response workers, emergency workers who are BIPOC, emergency workers more generally, and also correctional workers. On this slide, I outline the types of activities completed by researchers, more broadly speaking here. And there's been quite a range of the types of successful projects that have been funded. So many conduct surveys, interviews, and focus groups to understand the impact of traumatic events and post-traumatic stress injuries, to better understand workers' experiences and knowledge about post-traumatic stress injuries, as well as to understand factors that may influence uptake and effectiveness of interventions. So for example, researchers from the Institute for Work and Health in Ontario conducted interviews with key informants from Alberta first responder organizations to get a better understanding about the implementation of PTSI policies and programs, and to get a better idea of what the barriers and facilitators are. These interviews were followed by a workshop to develop a practical implementation approach for PTSI policies and programs. And moving on to our second bullet here, other research studies have developed and or evaluated the effectiveness of specific interventions or program implementation for specific workers. Examples of interventions include using wearable devices to monitor post-traumatic stress injury precursors or risks, so for example, by using wristband devices, treating post-traumatic stress injuries in first responders using transcranial magnetic stimulation, and using virtual reality for the self-management of PTSI in first responders. And some examples of evaluations include the evaluation of a reintegration program for police officers in the Edmonton Police Service. So in this project, they looked at if the program helps to enable return to work, and if it affects organizational mental health knowledge, stigma, and workplace culture. They then carried on to assess if this program could be adapted for ICU and ER nurses. Another study evaluated an online psychoeducational support program for emergency healthcare workers. These were for nurses and social workers. So this is a program that was co-designed with nurses and social workers, and which included virtual cognitive behavioral therapy and real-time feedback from an AI stress assessment tool. And then moving on to that third bullet there, research projects can also develop materials for community partners and stakeholders based on their study findings. So these might be in the form of workshops, skill toolkits, and even programs. And here are just a handful of specific examples of funded research that you may be interested in. I'm going to go through these briefly, since seeing what others have done might spark some ideas, or at the very least, I think it'll give you an idea of what the scope of these projects are like. In this first example, Leshevich looked at moral injury among long-term care workers. So moral injury is the pain or anguish of knowing but not being able to do what is needed due to constraints outside of your control. So the research team wanted to understand how to better support long-term care workers' mental health needs, including moral injury, and what workers thought of currently available mental health tools. They also developed a mental health support and moral injury prevention toolkit. In the end, they did find that there was a communication gap between frontline staff and leaders, which meant that leaders were unaware of how to provide support, and frontline staff were not able to really ask for support. And so they developed an app following this in hopes to remedy this communication gap. The second project listed here will help to understand traumas among BIPOC first responders. In particular, the research team wants to gain a better understanding of the prevalence of racial, occupational, and non-occupational traumas, how these traumas interact, and how emotional and interpersonal processes may impact trauma and PTSI. The study is in progress, and their findings will help to inform PTSI treatment and to increase awareness of PTSI amongst this unique group of workers. And then the other examples listed here include a study looking at PTSI among correctional workers during COVID-19, and the other explores how to identify first responders who are at risk of mental health injuries following musculoskeletal injuries. And this is important, especially given that workers with both physical and mental health injuries are much less likely to recover. And here are just 4 more examples that I'll go through briefly. In the first, Malloy and colleagues look to identify if Alberta's police officers and dispatchers feel that moral injury is relevant to them, and to identify factors related to moral injury within this group. In the second example, the researchers specifically looked at occupational stressors among public safety communicators, which was novel. They explored what the occupational stressors are, how findings could be used to inform emergency communication curriculum and training. In the third example, Grady's research team looked to better understand what the situation is related to preventing PTSI in early career paramedics. And they did this through literature reviews, surveys, interviews, and focus groups. And in the final example, the research team looked at occupational stressors specifically among police who are working at highly contentious mass protest events, for example, related to COVID-19 restrictions or the Israel-Palestine conflict. And on this slide, I'll cover some of the main types of activities completed or proposed in the services stream. So many deliver programming. For example, they may request funding to deliver peer support programs, expert-led training, drop-in psychoeducational support groups, transcendental meditation, facilitated workshops, and to increase access and reduce barriers to counseling programs. Training has focused on workers themselves, but also their families, supervisors, supports, and also healthcare professionals that seek to provide care for impacted workers. An example of culturally appropriate programming can be seen with the activities of the Stoney Nakoda EMS, who incorporated sweats, picking sage and sweetgrass, and smudging to support the physical, emotional, mental, and spiritual needs of their EMS first responders. Other projects develop and adopt tools, including protocols, guidelines, mobile apps, peer-to-peer support programs, and resiliency programs. For example, with part of the funding they received, the town of Whitecourt developed post-incident protocols and critical incident stress management guidelines. They also adopted and implemented peer support guidelines and resources, in addition to training and awareness building. And finally, there have been some unique approaches to increasing knowledge and support, including creating peer support helplines and also lending libraries to better disseminate information on PTSI, mental health, and also the resources that are available. And here I've highlighted one services project that has been funded and is currently in progress. So here the Bears Paw First Nation was funded approximately $120,000 to address the needs of emergency workers in this remote and rural community. So as part of the 2021 opioid response implementation plan, the community here developed a community emergency response team that attends drug poisoning events and that is also trained in non-crisis intervention, suicide prevention, mental health first aid, and harm reduction. So they're implementing a pilot program to focus specifically on community support workers who act as first responders. In this program, they've contracted a psychiatric nurse who is specialized in PTSI prevention to support workers before and after callouts, to train team leads, and to co-develop coping strategies for members. The project also includes regular training sessions to determine how best to respond to traumatic events, as well as workshops and informational meetings. One of the goals that the team is working towards is to develop specific policies and protocols aimed at the reduction of PTSI among this group of emergency workers in this unique setting. Okay, so now that you have a sense of the types of projects that have been successful, let's move on to talk about how to apply for SPHIFR funding. The next funding cycle will launch in March or April of this year. If you'd like to receive an update on when the next cycle is launched, you can email our email address, sphifer@gov.ab.ca, to request to be added to our mailing list. When you're applying, we encourage you to first review the application guidelines and forms. So this will help you determine if you need to apply to Stream 1 for services or Stream 2 for applied research. You can view the stream-specific guidelines and applications from the past year online at our website. The guidelines will highlight who and what is or is not eligible in terms of the applicant, the project, and the budget. For example, for services, the applicant must be a nonprofit or public sector organization that is operating within Alberta and is already delivering services. The proposed project has to provide new services that effectively support a group of Alberta first responder or emergency workers living with or who are at risk of developing PTSI. And again, as I mentioned, the project must be completed within 12 months. For research projects, the applicant must be affiliated with a Canadian-based organization and have the qualifications and expertise to complete the study. In addition, they must agree to provide the study's data so that we can publish it on our open data portal. The project has to generate evidence on prevention or intervention for PTSI in first responders or emergency workers, and similarly be completed within 12 months. Note that for both the research and services streams, applications can build off of previous work. However, previous success in the SPHIFR program does not guarantee funding for subsequent projects. Follow-up projects will still be assessed in comparison to other applications that are received in that year through our competitive process. The second step is to complete the application package. So you'll be able to access the most current downloadable application form online once the program has launched. Different types of documents will be required depending on the stream that you are applying to. So for example, for the services application, you may need to include incorporation documents and also a letter of support from partner organizations. For an applied research application, you will need to include resumes for principal and co-applicants, references, and any supplemental documents like images or tables. When you are preparing your application, please do try to put yourselves in the shoes of the reviewers. So the reviewers will base their evaluations on all sections of the application and only on what you provide in the application. So you need to make sure that you include all relevant information. For example, you'll need to clearly show us how the service or intervention is evidence-based and how the research or project will make an impact on PTSI in first responders or emergency workers. You'll need to demonstrate that you will be able to complete the project on time and that you have considered the risks that may impact the progression and completion of your project, and also how you plan on addressing or mitigating these risks. The reviewers may not be experts in what you are proposing, so having an eye towards readability would also benefit your application. And finally, when you are ready to submit your application, you just need to compile all attachments into a single PDF file, and you can email the completed package to our email, which again is sphifer@gov.ab.ca. So how are the applications reviewed? First, applications are reviewed at a high level by grant programming staff to ensure that they meet the base requirements, which are directly pulled from the eligibility criteria in the guideline documents. If the application passes the eligibility assessment, they move on to the full review. For the full review, we assemble review panels with subject matter expertise. So these may include other researchers, those involved in research services, representatives, including staff who are responsible for wellness and resiliency from first responder and emergency worker organizations, occupational mental health specialists, occupational hygienists, and so forth. Members of the review panel signed confidentiality and conflict of interest agreements prior to participating. We take the utmost care to ensure that there are no conflicts of interest. In the case that there may be an apparent conflict, review panel members will be excluded from certain discussions. Now, these 3 reviewers will evaluate each application. Each panel member will review the applications individually, assessing all the components of the application and taking note of their comments. And then again, I mentioned previously what you should consider when developing your application, but just to reiterate here, ultimately, the reviewers need to be able to understand what the evidence or context is behind the proposed services or research, how your project will make an impact on first responders and emergency workers, and they need to be able to see how you've considered the risks to completing the project on time and that the budget matches the project activities. In the review process, if applicable, we will consider an applicant's previous grant performance with the ministry. So we may not issue a grant to applicants who have not met the terms and conditions of previous grants. Note that the ministry will give preference to projects that also incorporate considerations of sex, gender, sexual orientation, ethnicity, Indigenous perspectives, geography, faith, income, gender identity, and gender expression. And then, okay, moving on to the final step of decision-making meetings. Following the individual assessments, the grant manager will then compile the reviewer's scores and comments and facilitate a group discussion in which different perspectives can be shared and in which the applications are ranked for funding based on their scores. We aim to be transparent in our evaluation and review process. Following the announcement of the successful applicants, we invite those who are not successful to reach out to us for a debrief. Okay, I'll pass it on to Craig to talk about his experience with the SPHIFR program.
Great. Hello, everyone. I'm just going to try to advance and get to my slides here. If you'll give me a second, please. Thank you. All right. Quick technology check, everybody. I should be showing you my SPHIFR Stream 1 Services Grant Program slide.
Looks perfect.
Perfect. Thanks, everybody. So thank you for having me here today. I'm Craig Gorenchik, the Executive Director with AMSA. And really my goal here today is to be quite brief and more importantly, not to speak at people. Lots of very able people are attending the session today that in many cases are very well knowledgeable about the challenges of first responders and mental health. And I'd like to be able to give you a quick at a glance type of view of the work that we've done and been grateful to work in this space. A quick slide on us as an organization. We're an organization as a not-for-profit that has been around for around 35 years, representing the needs of municipalities. Every town, village, municipal district, and city is a member of AMSA, and much of that group is well responded in terms of the first responder community. We work a lot in the space of psychological health and safety and training, and are a training provider accredited to the North American Standard for Training and Education. So without further ado, I can get into a bit of our chronology and experiences. This has really came to a large part with our partners. The Mental Health Commission of Canada has been our partner for an evidence-based delivery of the Working Mind First Responder. And in our first program, we really tried to be able to focus on the needs of rural first responders. Much evidence, I think, was still lacking, but we certainly heard from membership that in rural areas, certainly access to psychological services may be reduced. Also, the type of experience you may be in a small community responding to scenes of people that you know very well, which may not have the same exposure in an urban level of exposure. We also know there's a high levels of volunteer first responders in the communities. Our first grant, again, was a partnership strong with Dr. Keith Dobson of the University of Calgary's Psychology Department that really helped us with doing evidence-based quantitative meta-analysis of survey respondents to give us feedback. And TELUS Health also helped us with the launch of a distinct application of their Esprit app to provide resources, dedicated filmed footage of local rural first responders to really speak to those local experiences. And if there's a bit of a theme that I can say, it's listening to the needs of first responders. In our first grant that we had, kind of still in kind of height of pandemic, getting out here, we were all virtual delivery, and certainly heard from people that that in-person delivery would be greatly desired, but also heard from people a couple of different messages. One is that that type of mutual aid agreements that people had in rural certainly meant at times that there were urban cities that were responding to the rural areas. And so there was an expansion to be able to get support from the urban cities for first responder communities. And we also heard quite loudly in our first grant that very similar to military, when first responders serve, so do their family. And so lots of questions if we could have extended services. And so we did extend beyond the Working Mind first responder package to have a dedicated family package that would be provided free to a dedicated family members of first responders. And as well, we heard from people that there were non-traditional first responders in Indigenous communities that performed the role of first responders that had some dedicated needs. So we worked with those groups, and we're very proud to have done some large sessions that we did for the Métis settlements of Alberta, and received, again, some ongoing feedback from us on areas for improvement. We did expand into a larger first responder community overall. And again, in terms of our heard messages from people, we heard from people, it's great that you as an organization can give us spots for the first responder training that you're providing, but there were some very significant needs for ongoing sustainability of the first responders, for ongoing mental health training. Sometimes the first responders who were instructors were off on mental health leaves. People with succession, retiring, transfers in which they needed to get new trainers. So what we tried to be able to do was respond to the needs of having a train the trainer model. So in our new application was to be able to have a very sustainable, instead of people individually taking the program, we'll be going through educational cohorts to be able to do train the trainers, having a dedicated one for Indigenous peoples as well, and trying to make sure that we have a more sustainable model to help people keep those ongoing needs of supporting mental health for their first responder community. Feedbacks from a qualitative perspective, very positive feedback from people in terms of where they were in the mental health continuum. And some people, their first training, some people it was a session for them. And one of the things that we heard back from people as well is the need for booster sessions and to maintain competencies. And we'll talk about the needs and availability to do that in a bit. So Dr. Keith Dobson had done a fairly rigorous meta-analysis for us, and we had overwhelming positive support from people. But again, like all training, impacts waned after 3 months. Very positive early indications, and then after 3 months after not participating in the training, those competencies wane. So one of the things we tried to be able to do is in our next grant, we had booster sessions that were free for everybody to maintain competency. So at any time, self-serve, they could take the booster sessions. And those new a la carte resources on the free Telesys free mobile app for first responders and families was quite helpful. Again, focusing on a sustainability model for people was something we significantly heard. One item that we did struggle with at times was survey response rates. We did start off with lower survey response rates, and we did try to be able to survey people before they took the training, understand a baseline, immediately after, and then 3 months after. And we had to really put in a concerted effort to try to be able to get in our next grant a significant uptake in terms of survey responses, and we're able to achieve that in our next grant, but it really came down to at times the simple strategies as when people were in person, having everything available for them to fill out in person to have the increased chances of getting these surveys completed. And this one might not seem inherently as a problem, but the no cost or free training brought a few challenges. Sometimes we would see higher no-show rates or people back out when the cost of the value of free, I would say sometimes was a pretty low entry point to be able to back out from training, or perhaps people associated, if the training's free, how good could it potentially be? So we had to be able to really adjust with that to be able to make sure that we could get the highest amount of people going through the program. very quickly at a glance, from a more quantitative perspective, we saw it in terms of general mental health over the sustainability of the program, saw some improvements, survey trends overall in terms of people's resilience and coping skills. We got some good information, as well as the type of self-care activities that first responders were doing to try to be able to maintain resiliency and be able to mitigate the risks of post-traumatic stress injury. And I know I've done a very quick version here, given the very brief time that we've had to present, but I'd certainly be pleased to take any questions that anyone has.
Excellent. Thank you, Craig. So if you have any questions for Craig, feel free to pop them in the Q&A piece. And with that, we will move over to our representatives from Highmark. So take it away.
So great to be here. I'm Dr. Suzette Bramo-Phillips. I'm at the University of Alberta. I'm here with Dr. Chelsea Jones, both of us from the Highmark Initiative. So there's a large team of us that work together. This is one of the projects that we're going to be presenting on. Highmark is an initiative at the University of Alberta that's a provincial hub for supporting resilience, readiness, and growth of military members, veterans, public safety personnel. We do a lot of collaboration, partnership innovations, research, implementation of a variety of different initiatives, some of which have benefited from this particular funding call and the privilege of working with this team. One of the projects we're going to be presenting on, Chelsea will introduce you to, and it's around workplace reintegration for trauma-affected individuals in the public, who are public safety personnel. So with that, I'll turn it over to Chelsea, knowing our time is tight. Chelsea.
All right, thanks again for having us. I echo Suzette with gratitude, not only for having us today, but also for being a participant in this SPHIFR grant program. And yeah, today we're going to talk a little bit about the program of research that the grant has helped us facilitate and get off the ground. Our team at Highmark, as Suzette mentioned, we have a lot of different areas. We have a big team. With this one in particular, we have myself and Suzette. We also have a number of postdoctoral fellows, clinicians, graduate and undergraduate students, and other support and research staff that we want to thank and acknowledge as well. So our project on the workplace reintegration program, which I'll talk a little bit about in a moment here, engages with public safety personnel across the province of Alberta. And it certainly has been a phased initiative and an initiative that has grown lots of tentacles. And we're going to talk a little bit about how the project and the research has progressed today. I like to break it down into 3 phases. I call it our off the side of our desk phase 1, our phase 2, which was when we were funded by a SPHIFR grant for the first time, and we're able to do a little bit more targeted research. Phase 3 was our second grant, and the research and the project evolved a little bit more there. And then phase 4, the future phase, continuing the research, potentially expanding our program of research to other provinces, as well as taking a little bit more of a pragmatic approach where we're working with public safety personnel to create a facilitator training program and a trainer program that's a hybrid and can be accessed nationally and internationally. So first I'll talk a little bit about what is the workplace reintegration program. This is the it that we are studying amongst the public safety personnel and the organizations across the province here. The original workplace reintegration program was created by Edmonton Police Services back in 2009. And this is a peer-led program that has 2 arms, one looking at a response after a critical incident, and another looking at more of a long-term approach for people who have been off of work due to a PTSI. EPS has been championing this for quite a few years now, but it's a program that's been adopted by a number of organizations and professions, including fire, paramedical staff, Canadian Border Patrol. It's expanded across Ontario, BC, and actually there's some sites in New Zealand and the United States that are using the program as well. The key here is that it is a peer-led program. So they work very closely with clinicians,
other key partners, disability management teams, workers' compensation organizations. And this program is engaged in after the person has completed any clinical rehabilitation that they might have had to engage in after the PTSI or the critical incident. So the interesting thing about this program, and one thing that we realized quite quickly by engaging with the public safety personnel organization, is the organizations were running the program. They were really excited about the program and had some good anecdotal stories and accounts of how the program has helped them in their organization. But this program had not been studied from a more research perspective from external organizations. And we really didn't know for sure if it was safe, efficacious, effective. And that's where we came in. We talked to the PSP organizations, and it was evident that there was appetite to do a little bit more of a formal evaluation of the program, not only to make sure that it is safe and efficacious, but also to see if there was any improvements that could be made to make sure that we're offering our PSP the best possible programs that we can, and to help organizations with facilitating workplace reintegration and return to work after injury. So yeah, the study phase one, the off side of our desk phase, in 2019, we connected with Edmonton Police Services, and our first work looked at their facilitator training program and what was the effect of their training on the participants in terms of mental health knowledge, their view of the organization and the culture, stigma. So there's a few things that we looked at as a result of the training there. And it was clear that there was a need for a larger scale study that was longitudinal as well, and looked at that reintegration program specifically for the participants who were engaged in the critical incidents or had sustained a PTSI and were off work. So this phase, we were unfunded, and we were able to do a couple studies with that facilitator training course. And in this phase, this is also where we learned about the SPHIFR grant and applied for our first one. The organizations that we're targeting right now in Alberta through this research is, of course, Edmonton Police Services. They're the key partners that we're working with. Alberta Health Services, EMS, Calgary Police, Royal Canadian Mounted Police, K Division, St. Albert Fire, Edmonton Fire, and there's also multiple Alberta Health Services and Covenant Health departments and units in the province that have participated in our research, as well as we look at potentially contextualizing this type of program for other trauma-affected professions that might include nursing, doctor, and other healthcare professionals as well. So we were successful in getting that first grant in 2022, which was very exciting because we could do a little bit more of an in-depth evaluation and analysis of the workplace reintegration program. Our goals were really to explore if the program enables return to work of PTSI affected PSP, and if it was meeting the objectives that it had. Examine if the program increased work self-efficacy and engagement of the people who went through it. And also look at how the reintegration program might play into the greater organizational mental health and mental health knowledge amongst the organization. The other piece of this was also we looked at how the reintegration program, as I mentioned, might be adapted or contextualized for nurses, and hopefully we can expand this a little bit more to include other healthcare professionals in the future. This study phase is one that we continue to work on. We're hoping that we can continue with our data collection until about August of this year, and then we'll look at doing a multivariate analysis and wrapping up the quantitative piece of the study, where we look at the outcome measure scores over time. We were fortunate to publish a few papers on this topic, one looking at the qualitative results amongst the PSP this last summer. And I'll share a link at the end of the presentation today that gives a little bit more of a showcase of the knowledge translation products that we have published on the study so far. But the qualitative results certainly were quite promising, and the participants and partners that we worked with definitely felt that the reintegration program was something that was favorably assisting them with returning members back to work. Recently in the spring here, we were lucky again to get a second SPHIFR grant. This one again focused on continuing that phase 2 study. We also have the opportunity to look at some of the activities within the workplace reintegration program. So we get to be a little bit more specific about what we're looking at as the intervention or the thing that we're researching. A couple of the exercises that they use are called the up, down, and whiteboard exercises. And we're doing an evaluation within the organization, starting with EPS to see what the impact of those exercises in particular are. The other big piece of that grant is to help with looking at that hybrid facilitator training and train the trainer program. So we're currently working with Edmonton Police Services, and we'll be collaborating shortly with other public safety personnel programs, or public safety personnel organizations in Alberta to move forward with the creation of that. And that is a collaboration with Highmark, Edmonton Police Services, as well as the continuing education unit at the Faculty of Rehabilitation Medicine at the University of Alberta. So we're looking forward to continuing with that development. And in the future, we're hoping that we can do some beta testing in the next couple of years here and hopefully roll that out so that there's a little bit more fidelity amongst the training for the program. And it's something that can be spread and scaled a little bit wider if the results of our study show that the reintegration program is favorable. So we wanted to talk a little bit about our experience with the SPHIFR grant. We're have tons of gratitude to the government of Alberta for funding us for this project. We certainly would not have been able to do this research, this initiative, and scaffold it and scale it the way we have without that support. Our experience with the grant program has been quite positive. Certainly the application process, it was really well outlined today, but it was very straightforward. The timelines have been pretty clear, not just for the application process, but also as we run the project and the grant as well. The communication has been really accessible and clear. Questions have been answered very, very quickly if we have any, but we haven't had a whole lot because, again, everything has been laid out so clear for us. The reporting schedule has been quite manageable and realistic, which with some programs, it's a little bit more of a heavy load. So it's been nice and steady where we still have really good communication, but it's not something that is taking up too much of our time, and we can devote that time to the research activities themselves. We really appreciate having templates for the output. So for example, the final reports, the interim reports, the templates are really easy to use and ready to go. And there's also been a flexibility and openness that we've really appreciated with the funder on this project, where if we have ideas or opportunities come up, or we're looking to maybe change a timeline, change a budget line slightly so that our outputs can maybe be a little bit better, or we can do more. There's been lots of great discussion and flexibility, and this program has really allowed us to move things and change in a way that our outputs are more robust and we have more to provide for the public and for the funder in the end as well. With the way the phases have rolled out, we've been able to scaffold and scale the program of research. And it's become something that is hopefully going to give back to the public safety personnel community and the organizations. It's something that we have tangible results for that they can act on. And with the hybrid training program, that's something pragmatic that hopefully can benefit not just public safety personnel in Alberta, but across Canada and in other countries as well. So it's allowed us to scale this research and really create outputs and products that directly can assist public safety personnel in their organizations in the end. So we're really, really appreciative of that. And it's been really enjoyable working with this grant program. Suzette, I don't know if you have anything you want to add.
Yeah, just a beautiful part about the applied nature of the research, that getting results back to the public safety personnel quickly and also being able to work with them as partners in this grant has been exceptional together with the funders. So that collaborative partnership approach to be able to do real world applicable research that has meaningful impact has been really profound. So I think that's the other piece I'd like to just accentuate. Thanks, Chelsea.
Thank you. So next steps, I talked about this a little bit earlier, but we're going to wrap up our data collection, work on hopefully in 2026 publishing the results of the quantitative piece of the phase 2 study. We are going to continue with the hybrid curriculum development and testing, and we're also looking at potentially rolling out the study in Ontario in the future as well, as they do have quite a few sites there, policing more specifically, that are using the workplace reintegration program that EPS originated. As well, the program has also rolled out nationally with the RCMP, so that's another area that we're in talks with as well at the moment. Well, we're going to continue with the knowledge translation of our results via presentations at conferences, infographics, videos, and materials that we will make available to the PSP organizations, funding, and the public as we're able. So lots of exciting things in the future. I've included a link in the slides here to the published material that we have, the infographics, videos, and publications. I believe they might be able to share that link after the presentation today as well. So that gives you a little bit more information about our findings. But if you have any questions, feel free to give myself or Suzette an email, and we'll do our best to answer those questions. And here's a list of the publications that we've been fortunate to publish so far with this project, and hopefully more to come.
Excellent. Thank you for that. And it's great to hear you had such a good experience with our program. So we have one final poll question before we get into our little Q&A session of the webinar. So after this presentation, are you interested in participating in a SPHIFR project or in applying for funding? And I will leave that up while I navigate to the next piece. So as you can see, and has been mentioned, if you want to connect with the SPHIFR grant program, SPHIFR at gov.ab.ca. And we now have time for a few questions. So first, one of the questions in the chat: how often do grants cross streams? For example, start as a research grant and progress to a program grant? And I will pass this over to Dr. Karina Thomas for an answer.
Thanks very much, Catherine. And Valerie, thanks very much for the question. So it's really important to note that the grant applications must be in either one stream or another. So we don't actually have a crossover kind of feature to our grants. I know that some grants it's a little bit tough to try and figure out whether it's a research grant or a program grant, or a services grant, sorry. And so what I would encourage you to do, if you or an organization is interested in applying for the funding and has that question, to send an email to the SPHIFR program, and we're happy to connect with people to kind of talk through their projects and give them some advice as to which stream to apply to. So I hope that answers your question, Valerie.
Excellent, thanks. And I see there is a question in the chat, but I do also want to go back. We had a few people who submitted questions when they registered, and I thought this one was interesting. Is there space to add collaborators with lived experience in Stream 2 of the grants? It would be great to prioritize the experience of first responders to increase uptake of the research in this stream. So thank you if you submitted that question. And I believe, Ella, do you have an answer for that?
Yeah, sure. So we definitely do have space to add collaborators on the application form, and we kind of define collaborators as an individual other than the primary or co-applicant who will have a significant role in the conduct or intellectual direction of the project. So this most certainly can include a person with lived experience, but as with all the collaborators there, you will have to justify it in the application and demonstrate how they will be contributing to the project.
Excellent, thank you. Logan asks, are private or for-profit agencies considered for Stream 2 of the grant application? And Karina, I believe this could go to you.
Yep, I can take this one. Yes, so this grant program is just for not-for-profit organizations or for research institutions. So unfortunately, no, for-profit agencies or organizations are not eligible for either stream of the grant application.
Excellent, thank you. Going back to another question that we had submitted before the presentation, and We do have some more time if anybody wants to put any more questions into the Q&A. So here's a question from before. Does this grant program include social workers and nonprofit staff who may be responding to incidents prior to first responder arrival? Ella or Karina?
Sure. I can take this one. So yes, this can include social workers and nonprofit staff. So they would be included under the emergency worker side of things, as long as they do encounter kind of serious, dangerous, unexpected situations that could lead to PTSI. Yeah. Karina, do you have anything that you want to add there?
That was, yeah, I think you covered it all, Ella. To encourage people when they're writing their applications to really demonstrate how the emergency workers are actually encountering those serious, unexpected, and dangerous situations, to really kind of emphasize that they're emergency workers.
Excellent, thank you. Oh, I see in the chat, if you could please clarify the email address to which we should direct our inquiries, that would be great. Yes, so I will move the slide back one, but I'll also put it into the chat. So it's the program acronym is Supporting Psychological Health in First Responders. So SPHIFR at gov.ab.ca. This one is, does the nonprofit wishing to submit an application need to be registered in Alberta, or could it cover all Canadian, for example, a pan-Canadian organization?
Yeah, they can be registered in Canada, but they need to be operating in Alberta.
Excellent, thank you. And I believe that is all of our questions, and we are almost at 10 o'clock. So thank you, everybody. Thank you for our presenters, and thank you for our attendees for joining us. Again, if you do have any questions about this grant program, please email the address SPHIFR@gov.ab.ca, and we look forward to seeing more applications this year. Thank you, everyone.